The Anatomy Lesson of Dr. Nicolaes Tulp. The painting The Anatomy Lesson of Dr. Nicolaes Tulp by Rembrandt is one of the most important and captivating works in the history of art. It not only depicts the practice of medicine in the 17th century but also serves as a profound philosophical and ethical statement about humanity, science, and the responsibilities of physicians. This work stands as a pivotal moment in the history of art and medicine, raising deeper questions about life, death, and the meaning of existence. As we see, even after centuries, it continues to retain its allure and issues a call for a quest for the meaning of life, a search that never truly ends. Thus, the hidden secrets within this piece invite us to reflect on life, death, and existence, showcasing the power of art in expressing complex human concepts. In 1632, Dr. Nicolaes Tulp was appointed as the Prelector of Anatomy for the Amsterdam Guild of Surgeons. According to the Guild's regulations, dissection was permitted only once a year, and the body used had to belong to a convicted criminal who had been executed. These restrictions highlight the seriousness and sensitivity surrounding medical science at that time, as well as emphasizing the social and ethical significance of this event. Rembrandt, who was 26 years old at the time, was chosen to create this painting. With his innate talent and exceptional skill, he not only portrayed Dr. Tulp and his colleagues but also employed innovative techniques to create a complex and impactful artistic display that significantly transformed this genre. In this work, Rembrandt emphasizes Dr. Tulp's authority through his formal attire and dark large hat, holding forceps while dissecting and examining the anatomy of a condemned criminal's hand. The scene is filled with exploration and excitement, however, there is something about it that is not quite realistic, as the dissection typically begins with the heart or stomach. Given the conditions for preserving body parts in the 17th century and their rapid decay, dissection sessions usually started with organs such as the heart or stomach before moving on to the brain and eventually to the hands and feet. Yet, by choosing the hand as the starting point, Rembrandt raises a fundamental question. Is this choice arbitrary, or does it signify a deeper concept? Focus your attention once again on this masterpiece. This time, look at it from a different perspective. The secret of this work lies in the hands of Dr. Tulp. Dr. Tulp dedicated himself so faithfully and diligently to the field of medicine, providing significant and extensive services to the medical science, that Rembrandt has directed all attention towards comparing the hands of the executed criminal with those of Dr. Tulp. These are hands that have always been associated with crime and wrongdoing, now being dissected by hands that have consistently served education, aided the public, and contributed to science. The contrast between the hands symbolizes two opposing worlds, one of crime and transgression, and the other of knowledge and benevolence. Moreover, this painting not only showcases technical skills but also reflects the spirit of an era in which medical science was taking shape, and physicians were facing new ethical challenges. The hands of Dr. Tulp are aligned along a linear spectrum with a book in the right background frame. This book is likely De Humani Corporis Fabrica by Andreas Vesalius, which pays homage to the valuable contributions of predecessors who dedicated their lives to the advancement of science. This choice not only emphasizes the importance of the history of medical science but also illustrates Dr. Tulp's respect for his predecessors and fellow physicians who laid the groundwork for scientific advancements in their time. On the other side of the hands, we observe faces filled with eagerness and curiosity, fully engaged in learning from Dr. Tulp. Although all these figures were prominent individuals of their time, they also symbolize future generations of medical science who are being educated in the present and developing it within society. Such symbolic visualization of knowledge transfer as a cycle that carries science from the past to the future is rarely seen in artistic works. With this intelligent choice, Rembrandt not only captures a specific moment in medical history but also establishes a profound connection between generations. The clever use of chiaroscuro enhances the atmosphere of the scene while simultaneously giving special power to the individuality of each person within it. Excluding the seventh figure who holds a paper close to Tulp, the other six are positioned in such a way that together they form an arrow pointing toward Dr. Tulp's right hand, which holds the forceps. This arrangement heightens the dramatic weight of Tulp's position in the scene and signifies the particular attention that the medical community pays to the science of anatomy. Additionally, the dissection of the hand carries an indirect religious connotation that Rembrandt employs to illustrate the traditional belief that the hand is one of those parts of the human body that receives special attention from God. In this way, Rembrandt seeks to convey that just as the human body is a creation of God, so too is the art of dissection a means of attaining divine knowledge. Through his artistry, he narrates a complex story of life, death, and the quest for a better understanding of the world. This technique emphasizes not only the connection between crime and punishment but also aims to portray the transience of human life.